Welcome to Mind's Physical Activity and Mental Health Toolkit. The next few minutes will provide an insight into the 10 guides co-produced and developed with physical activity and mental health organisations, including experts by experience. You can access the guides directly from our website at mind.org.uk. Once landing on the homepage, if you click on About Us, Our Policy Work, Sport, Physical Activity and Mental Health, this will then bring you to our main sport and physical activity page. Scrolling down, you will see the resource section and a direct link to the Mental Health and Physical Activity Toolkit. Clicking on this link, you will see access to all 10 guides, including our toolkit glossary. By clicking onto each individual guide, you will be able to download or access the guide, including the tools and templates and the case studies. You can also access the guide by typing in your toolbar, mind.org.uk/sport. This will bring you directly to our physical activity and mental health webpage. Again, rolling down to resources and clicking on Mental Health and Physical Activity Toolkit to access the 10 guides. Since the launch of the toolkit, we have received lots of positive feedback on how it will help organisations to be more inclusive to people experiencing mental health problems. One of our partners, Merseyside Sport Foundation, says the toolkit will influence all of our work by providing the right balance of tools and instructions to take bolder steps in being more inclusive and proactive about improving mental health. So what's included in the guides? The toolkit is made up of a variety of guides, ranging from an introduction to mental health, engaging people in physical activity to support their mental health, safeguarding mental health, and many more. Our Mental Health and Physical Activity Toolkit aims to increase the number of sport, physical activity, and mental health providers who are equipped with the knowledge and skills to support and engage people experiencing mental health problems in physical activity. Each guide has downloadable templates you can use or share with others. For example, recruiting volunteers or those with lived experience in your work. Checklists and tips for engaging people with mental health problems, and general facts and statistics on mental health and physical activity. All these tools and templates are easily downloadable to take home and use at work. We know real-life examples bring each guide to life. Each guide puts examples of theory into practice by providing an insight into fantastic programmes and projects on the ground, from local minds to community and voluntary services to the NHS and primary and secondary care. So who are the guides for? Our guides are designed to support anyone working or volunteering in sport, physical activity or mental health, from coaches to leaders to programme leads and managers. We hope that you will find all the guides useful on your journey to supporting more people experiencing mental health problems into physical activity. For any more information or any questions around these guides, please contact us at sport@mind.org.uk. You can also access the guides by visiting our website at mind.org.uk/sport. Over the next few minutes, we will see some quotes and hear some video recordings from some of our sport, physical activity and mental health partners, including experts by experience. They will cover the impact that the physical activity and mental health toolkit can have on the sport, physical activity and mental health sector, including individuals. Rebecca Jones from Sport England and the National Partnerships Lead for Health quotes that Mind's research has shown the growing number of people who have experienced mental health problems since the pandemic. Yet these people are experiencing more difficulty in becoming or staying active. Now more than ever, sport and physical activity can play a role in supporting these individuals, and Mind's Mental Health and Physical Activity Toolkit is an excellent and comprehensive resource to help individuals and organisations understand how they can better support people with mental health problems to become active. Kate Scott from Leicestershire and Rutland Sport Active Partnership quotes that Mind's Physical Activity and Mental Health Toolkit will be an invaluable resource for all involved in delivering physical activity, whether that's professional organisations, clubs, or community groups, especially at this time when the mental health and well-being of all is priority. Also quoted that the toolkit will enable physical activity and sports practitioners and volunteers to have a better understanding of mental health and provide them with the confidence to support their participants appropriately.
Hello, my name is Lucy Tappin. I'm from Active Oxfordshire and I coordinate the South East Active Mind Network.
Hello, hi, I am Hamid Khan. I am ex-service user of mental health services. I'm currently a carer for my mum who has physical and mental health issues. I got involved with the Physical Sports and Physical Activity Alliance with National Mind, which was a project about looking at how can health and well-being centers, sports centers, physical recreation centers become accessible, inclusive and welcoming with appropriate support for people with mental health problems.
Hi, my name is Kate Scott and I'm a Sport Development Officer with Leicestershire and Rutland Sport. My remit is around equity and inclusion, and some of my programmes cover women and girls, older adults, those with disabilities and long-term health conditions and diverse communities. The aim of the work I do is to enable as many people as possible to participate in physical activity, taking into account additional support which may be needed for different audiences.
Hello, my name is Debbie. I have a lived experience of physical and mental health issues for over 40 years now. It has been difficult, but my life changed in my late 50s when I got involved in sport and physical activity. My life is now enriched with many, many friends. I work in the area. I'm more confident, more outgoing, and have the ability to be quite good at different things that I achieve and do these days.
We've been using the toolkit now and passing it on to members of the network across the South East. And we've found it a really beneficial tool to use and really easy to work through and really easy to access. It gives you all the information you need in one place. It gives real life examples and case studies, which I find really useful because that's the way I like to learn, and I like to see real people and real stories. And it gives you all the templates and tools you need to work through these things yourself and support you to engage people with mental health problems to be active. So from feedback from ourselves at Active Oxfordshire and members of the network and beyond, the feedback we're getting is that it's really invaluable. It's really useful to go through this toolkit, to look at the different topics and really think about what you do, what you need to do and what you can do to support people to access physical activity. So I'd encourage you to use it yourself, to go through it, and also to support others and to pass it on to your partners and anyone who you think would benefit from using this toolkit. Thank you for listening and thank you for your time.
The toolkit is absolutely fascinating in the sense that it's actually something that gives you the correct information and knowledge about how you can work towards developing physical activities for people with mental health problems, what to look out for, how to support people, how to look out for signs for people who have got mental health issues, and also how you can maintain and sustain those people with mental health issues to continue to use your sports and physical activities that you provide. I highly recommend the toolkit. I think it's brilliant in the sense that it's user friendly. It covers key themes and topics, and it's something that you can read in full detail or look for messages or information that you need at the time. Therefore, I'm very pleased and look forward to this toolkit being cascaded and promoted across different organizations. Thank you.
The Mind Physical Activity Toolkit is a practical and beneficial way in raising awareness of mental health, recognising signs and symptoms, and putting strategies in place. The toolkit is straightforward and easy to use and lays out lots of great examples of good practice which we can learn from, as well as outlining templates on how to create the most appropriate environment for people with mental health difficulties to get the best out of participating in physical activity. This is more prevalent at the moment as we come through what has been a turbulent year, especially for those who need some extra support and guidance to gain the confidence to participate and enjoy the many benefits of being involved in physical activity. By supporting our workforce, we have more awareness of mental health and being more confident in their engagement and delivery. This will lead to enabling more people to access physical activity opportunities and to support their health and well-being. Leicestershire and Rutland Sport look forward to promoting the toolkit to all our partners as an essential resource to support organisations, delivery staff and participants.
I first started to work with Mind a few years ago now, when I was lucky enough to be chosen to sit on their physical activity advisory group. I'm also latterly privileged to chair the working group on a new project around when physical activity becomes a problem. This is around people who, like myself, again, I have a lived experience of over-exercising, and I also have an eating disorder diagnosis which run side by side. It's not always eating disorder people that over-exercise. There are other people with other issues that take the problem on. The Physical Activity and Mental Health Toolkit has been put together by people with lived experiences and people who work in the sports arena, and of course people who work for Mind. I would recommend the toolkit to anyone. There is so much information in there about how to get started looking after people who have mental health issues. There's information in there around volunteers, how to inspire them, how to keep them. There's information in there around funding and sustainability. All these important aspects of working with people with mental health problems are in the physical arena. Thank you.
Welcome to Guide 3, which is around involving people with lived experience and mental health problems in the design and delivery of your work. At Mind, we work hard to understand the needs of people experiencing mental health problems, and this drives everything we do. We actively seek opportunities for people with lived experience of mental health problems to get involved with and influence our work wherever we can. We've put this guide together to help you involve people with lived experience of mental health problems in your work. We explain how to involve people in the design, the development, and the delivery of new and existing physical activity projects and services. So what is lived experience involvement? At Mind, we define this as the development and promotion of opportunities in order that a diverse range of people with lived experience of mental health problems influence and participate in our work. There are many ways that you can involve a person or people with lived experience in your work, and that involvement depends on what you are trying to achieve. Shown on screen are the 4 levels of lived experience involvement, going from short-term involvement to longer-term involvement. If you are looking to gain insight in a programme or resource from a wide range of people, you may choose level 1, which is consultation. And the consultation might be through surveys, interviews, or questionnaires. These involvements are often short-term. You may wish to expand on that by working together, by hosting discussions and focus groups. Level 4 and a higher level of engagement is doing together. You may decide that including people with lived experience from the start to the finish of designing and delivering a programme is for you. This is called co-production or co-design. The guide will support you to make a decision on the level of involvement, but will also help you to plan your opportunity. You may choose to work in partnership with a mental health organisation to make sure you have the right support and procedures in place. There are many benefits to including people with lived experience and mental health problems in your work. It's a two-way process, so the person or people involved will also benefit from the experience. Some benefits for organisations include achieving a clearer understanding of your audience needs, that your target audience are more likely to attend your services for a longer period of time. And you will also build more credibility with the public and funders. Benefits for the person or people is that people are more likely to feel more valued and respected. They have the opportunity to share their voice and their feelings, develop people's motivation to take part in physical activity or set up their own events. And they might even support future employment and more opportunities to be involved in your services. An example of how involvement has benefited a person, one of our physical activity advisory group members quotes that when I applied for the role, I had been employed for a long time. The role helped me link up with opportunities that acted as a springboard to my current job. So what's included in the guide? The guide is a step-by-step process to help you plan, recruit, and prepare for lived experience involvement, including tools to help you plan your lived experience opportunity, templates to download, such as job descriptions, to help you recruit people with lived experience, how to support people in the role, tips and considerations when setting up that involvement opportunity, templates and tools that you can download and use in your organisation, and case studies of good practice examples. This guide also includes good practice examples from sport, physical activity and mental health organisations. Mind's physical activity and mental health regional networks involve people with lived experience at all levels, including level 4 as discussed earlier, which is deciding together. We hope that you will find all these guides extremely useful on your journey to supporting more people experiencing mental health problems into physical activity. For more information or if you have any questions, please do contact us at sport@mind.org.uk. Don't forget you can download and access all of these guides by visiting mind.org.uk/sport.
Hi, I'm Nicola Dean. I'm a Safeguarding Adults in Sport manager for the Ancraft Trust. The Ancraft Trust has been working for nearly 30 years in lots of different settings, trying to embed the concept of safeguarding adults in them. Basically, we want to make organisations safer for everybody. We're really pleased that we are funded by UK Sport, Sport England and Sport Wales now to try to embed safeguarding adults within sport and activity organisations. To be part of the toolkit with Mind has been great. It's a really good way of getting out the message of safeguarding adults to sport and activity organisations. One of the things that often comes up with sport organisations is knowing how to support people with mental health problems. So the toolkits, they're a really good way of giving information to clubs and to organisations that are working with any adults, but also those adults with mental health problems. And obviously people with mental health problems can go to any sport activity, any club. So it's worth any sport activity, club or organisation having a read of them. They give a really good example of how to embed safeguarding adults practice within the organisations. And then they look at an area that is really important when you're working with people with mental health problems around how to manage risk and how to think about people who may be a risk to themselves. So if we're thinking about safeguarding adults, we're often thinking about people who are at risk from other people. but if you have a mental health problem, you could be a risk to yourself. So the toolkit that we were involved in is looking at safeguarding and at managing risk. So it gives lots of good examples of how you can think about embedding safeguarding, thinking about your policies and procedures, thinking about how you get information out to people. And then it also looks at how you basically speak to somebody who you've got concerns about, where you're concerned that they are possibly a risk to themselves. And obviously one of the things that we speak about in safeguarding is about putting the person at the centre. And this toolkit really does. So it gives some examples of how you might try to have a conversation with somebody and how you might deal with some of the issues that you're concerned with. So having a conversation is always the first step. Whether it, if you've got a concern about an adult, have a conversation with them, speak to them. And this MAN toolkit will give you some examples of how you can do it and just make you feel at ease with it. So please have a read of it, get the information out to people in your clubs or your groups, and everybody's got the right to take part in sport and activity free from abuse or neglect. That's just a right for everyone, and we want that same thing for people with mental health problems. We've all got this right, and I think all clubs and sports organisations have got a duty really to think about how they deal with issues that crop up and do them in a really person-centred way. So we're not doing things to people, we're actually supporting people and getting some help for them if need be, but also just listening and making sure that they're okay. So thank you.
Hello and welcome to Guide 9 of our Mental Health and Physical Activity Toolkit. Now this guide focuses on safeguarding and mental health, and we created it in partnership with the Ancraft Trust. Now we've produce this guide to help you to include adult safeguarding elements in your activities and also to make them safe for people who experience mental health problems. And the guide includes a range of elements around safeguarding and mental health, including what is safeguarding, adults at risk and adults at risk from themselves, boundaries that you need to consider, confidentiality and when and how to break it, the support available to you around safeguarding and mental health, as well as frequently asked questions. And throughout the guide, we use tools and templates, as well as case studies and good practice examples to bring the guidance to life and to make it easy for you to integrate this into your work. We'll just run through some of the key information that's provided within the guide. So, what is safeguarding? Well, safeguarding means protecting people's health and well-being and human rights. And it is everyone's responsibility. Adults at risk. So safeguarding looks to protect adults at risk. And adults at risk are people who have care and support needs, are experiencing or at risk of abuse or neglect. And as a result of those care and support needs, they're unable to protect themselves from either the risk of or the experience of abuse or neglect. Now, it's really important to note here that not everyone who experiences mental health problems will be classed as adults at risk, but there certainly are quite a few. This guide also covers adults at risk from themselves. So safeguarding protects people from others, whereas at mine, we've developed an approach called risk management, which aims to protect people from themselves. This could be because they're considering self-harm or suicide. And in this section, we sort of provide information and guidance on how to create a risk management approach for your organisation, group or club. The guide also covers boundaries. So boundaries exist to protect everyone, and it's not just for your participants. And setting clear boundaries is essential for all services, but particularly for physical activities that are aimed or support people experiencing mental health problems. So within this section, we contain examples of boundaries and what's not appropriate in a sport and physical activity setting. Top tips for setting and maintaining boundaries. And then we've also got a good practice example from England Athletics Mental Health Champion Scheme. Confidentiality. So breaking confidentiality is when you tell someone else about information that has been disclosed to you. And this can be a really confusing, challenging and grey area. So it's important that you have a policy on when and how to break it. So within this section, we actually provide recommendations for when and how to break confidentiality, including some key scenarios and what you should do in those scenarios. We also highlight the support that's available, because safeguarding can be quite challenging and confusing, but there is so much support available to you, including from the Aircraft Trust and from your local authority's Safeguarding Adults Board or partnership. In addition, there's also lots of training courses to help those responding to safeguarding concerns, and we've listed quite a few of these, including introductory, intermediate and advanced courses. There's also some advice on how to support your own mental health or the mental health of the people at your organisation, club or group who deal with safeguarding concerns. So to help with integrating safeguarding elements into your activities, throughout the guide we've provided tools and templates, but also frequently asked questions. So these are things that have been asked to ourselves and the Aircraft Trust around mental health and safeguarding. So it provides guidance on what to do in certain situations. You may find yourself in similar situations. These can be really useful for that. And then we've also developed a tool, Safeguarding Adults at Risk Checklist with the Aircraft Trust. This is a really good place to help you create and integrate policies and procedures on safeguarding adults at risk. And then we've also developed guidance on how to have conversations around mental health, including starting, managing, and closing conversations. So we really hope that this guide will help you to include adult safeguarding elements in your activities so that you can make those activities safe for people experiencing mental health problems. This guide can be accessed on our website, so at www.mind.org.uk/sport. And if you have any questions around the guide or mental health or safeguarding, please do contact us at sport@mind.org.uk.
Welcome to Guide 4 on making physical activities inclusive to people experiencing mental health problems. This guide aims to support the sport, physical activity and mental health sectors to make physical activity sessions and projects more inclusive, accessible and welcoming to people experiencing mental health problems. The guide is made up of tools, good practice examples and resources that you can use to design, plan and deliver physical activity. Some of the resources in the guide include using a person-centered approach. So for example, taking time to get to know each of your participants, their motivations, interests, and also when taking part may be a challenge. A person-centered approach helps you truly understand each participant. There is also information on adapting activities with a step model, which I will go through in more detail in the next slide. However, the step model provides practical examples of how you can adapt your session to include everyone. There is also information and resources on the care model, which will help you promote good mental health through your coaching. The 10 principles, which are adapted from the Activity Alliance model, which provide 10 values sport, physical activity, and mental health providers can use to make their activities more appealing to people experiencing mental health problems. And then finally, training opportunities, both formal and informal, which will upskill and increase confidence within the workforce on mental health. One of the most useful tools for deliveries is the STEP model. This model helps you make sessions inclusive for everyone, including people experiencing mental health problems. STEP stands for space, task, equipment, and people. By making small changes to each of these elements, you can adjust sessions for people's needs. A few examples of this model are on screen. So for example, space. Can the activity be provided at a local community centre where the participants regularly visit and feel comfortable? Task. Can you add social elements to your session to allow the group to team build, interact and work together? Equipment. Can you record the session so participants can try activities in their own time? And person. Offer the opportunity for people to watch the first few sessions. This will help them build confidence and feel more comfortable about joining in the future. There are many tools throughout the guide which provide practical examples of how you can ensure your session is inclusive, from planning your session to the environment that you're in, to the way that you can communicate with your participants. A great example of how you can make your sessions more appealing and inclusive are the Activity Alliance 10 to Talk to Me principles. We've adapted the main principles to include people experiencing mental health problems. Some examples may be reassurance when they first join the session. Does that person feel that they are standing out? Can you be welcoming and make sure that they know that this session is suitable for their needs? Can you focus on that person and not their diagnosis? Focus on what they can do and how they are, rather than diagnosing them or seeing them as someone with a mental health problem. Show me. Can you show the building where they might attend first? Can you record the session and what a particular session looks like? Or can you ask them to meet 10 minutes earlier so they can feel comfortable and understand what the session might include? Upskilling your workforce about mental health means you and your team can deliver activities that better support people experiencing mental health problems to be physically active. This doesn't need to be through formal training courses, but we include a list of training in the guide. Though we're not endorsed by Minds, there are a selection of free and paid courses. Informal methods can also help you increase knowledge and confidence, from reading resources to case studies and research, speaking to people with lived experience in mental health problems, or observing others delivering similar activities. A quote from a participant who took part in our On Your Side training through the English Football League partnership quotes that this course has really helped me to understand mental health and give me insight into what my players are going through. I am coaching them tonight and I'm going to make sure I approach conversations differently using the care model. Throughout the guide, there are many case studies that share good practice examples and challenges of providing an inclusive physical activity opportunity. Roshnigar, in the clip on screen, are a mental health charity who provide culturally appropriate, responsive services for South Asian women experiencing mental health problems. As part of their services, they were keen to support the women to become more active to support their physical and mental health. They contacted a local physical activity organisation who worked with them to provide regular seated exercise and swimming sessions. Good practice examples include working in collaboration with a sport and physical activity organisation. They co-produced the sessions with members of the charity. They offered the service initially upstairs in the community centre where the women felt comfortable. They took time to adapt a person-centred approach and understand the challenges to participating and how to work together to overcome them. And they adapted the session as per the participants' needs. So every couple of weeks, they checked in with the participants and making sure they were still enjoying the opportunity and there was any way that the coach could adapt the session.
We hope that you will find all these guides extremely useful on your journey to supporting more people experiencing mental health problems into physical activity. For more information, or if you have any questions, please do contact us at sport@mind.org.uk. Don't forget you can download and access all of these guides by visiting mind.org.uk/sport.